Hi, and welcome back to Clinician Spotlight. My name's Tony Maritato, and joining me in just a moment is Katie Wadlin. So Katie is a doctor of physical therapy and the owner of Healthy Aging Physical Therapy. Katie and her team help patients in their homes in the Massachusetts area when they're recovering from either an injury or post-surgical care. They also help individuals who have neurologic conditions. So let's see if we can get Katie on the other end and we can ask her some questions about her business. All right, Katie, thanks so much for coming on today. So I like to start every interview with the most basic question of how did you become interested in physical therapy? Like, what was the backstory? How did you get to where you are today?
How did you get here? Sure, absolutely. So when I was growing up, I always volunteered in special needs departments. So I taught adapted swim classes. I worked at a camp for folks with disabilities, and I loved it. And I was sure I would go into either special ed teaching or recreation departments. And then I went to college and I took my first physiology and anatomy class and became obsessed with everything neuroscience and body science and biology. So I had to find a career that sort of met both of those in the middle. So I ended up volunteering for a children's hospital, and I watched the child life specialist work and the OTs and the PTs. And I, quickly found that PT really suited my personality. So
Yeah,
that,
I agree. Like that was it for me.
yeah.
I just fell in love with the anatomy and the
Yep.
physiology, and I always loved human movement and human
Mm-hmm.
mechanics. So what's interesting about your business model that's different from traditional therapy is you're delivering services in the client's home. Can you
Yes.
tell me a little bit about that? Like, how is that different from somebody who's doing Medicare Part A home health? And then what are some of the main conditions that you're treating in the patient's home?
Sure. So I'll even backtrack a little bit to how I ended up here, the second part. So I started my PT career working as an outpatient neuro rehab therapist. So traditional clinic, you go in, you see them, you leave. I stopped that maybe 10 years ago and transitioned to home health. So then I worked as a Med A home health PT. So your traditional, you go to the hospital, you get sent home with VNA. So I was that therapist for a while. I left that job in May of 2020 to start Healthy Aging PT. So now I basically do what's a mix of both. So it's outpatient clinic that comes to you, that sees you at home, but uses your outpatient Medicare B benefit. So the
Wow.
nice thing about this is that when I worked in home health, I loved being in home with people, but at the same time, our visits were so limited, and they were limited by standards within the industry and within Medicare A and within the places I worked for. So people really didn't get as better as they could be, for lack of a clear way to say that.
Sure.
You'd have to really go to an outpatient clinic next to get that next level of care. But the folks I was seeing really couldn't get from home to an outpatient clinic either easily, they might need a ride, or they might be so tired by the time they got to the clinic that they couldn't participate. So there's this whole group of folks that really get stranded, for lack of a better term. They get discharged from home health. They get told you should probably have more therapy, but they can't get to more therapy. And they just get worse at home by themselves. So that's where we come in, myself and my team come in, and we can see the people that really still need the care, but wouldn't be able to access it otherwise.
And you are a Medicare contracted provider.
Yep.
But for those individuals that maybe don't have Medicare or they've exhausted their benefits or they had a Medicare Advantage plan that's run out of therapy, you also
Yeah.
offer self-pay services as well, right?
So we do a little mix of everything. So we take Medicare B, like I mentioned, which covers therapy almost in full. Medicare B pays for 80%. And usually folks have another supplemental plan that typically picks up the other 20%, which is great. If someone has a Medicare Advantage plan and they have out of network benefits, which most of them do, we'll also take that. So that takes a little bit of back work to get the referral in place, but usually that pays for therapy with some small copay. Or we're also contracted with Blue Cross Blue Shield, so we accept that insurance. And then, yes, the last option is self-pay. And I always tell my patients and my clients, I actually hate self-pay. I'd much rather charge your insurance. So I always try to exhaust all those options first. And my last option is charging someone out of pocket.
And what are the cities that you're serving in Massachusetts?
Sure. So I actually live in Wakefield. So I'll go to any towns that touch Wakefield. So we have Stoneham, Lynnfield, Reading, Saugus, sometimes Wakefield. And then I have two therapists that are out of Melrose, Malden. So they go to Melrose, Malden sometimes, Medford, Winchester, and they'll overlap with me in Stoneham and Wakefield. And then my fourth therapist, Tammy, is over in Concord. So she'll go to Concord, Belmont, Arlington, and sometimes Newton. So we have these sometimes towns. So it depends. So if you're outside of those ranges, don't hesitate to call us and we can talk about, what we do for outside of our areas.
That's awesome. Before I
Yeah.
ask how people can get in touch with you, what are some of the most common conditions that you're seeing? Who's like the ideal person who's sitting at home and really would benefit from these services?
Sure. So myself and Tammy are both board certified geriatric clinical specialists. So we really specialize in working with older adults. Allison and Sam also have extensive experience in geriatrics. So that's our primary group, is people that are older, over 65, people that may be limited by fear of falling or have had some falls and want to work on their balance. We see a lot of folks with balance impairments. We also all specialize in Parkinson's disease care. So myself and Allison, we're certified in what's called Power Moves therapy, and Sam is certified in Big LSVT. And Tammy has been working with a PD population for 20 years and knows more than all of us combined. So we really specialize in Parkinson's as well as other neuro-related diagnoses like stroke and brain injury and MS, and pretty much anything that comes our way, we're happy to see.
And I've got to think, like, I know for myself, when my mom was aging and her health was declining, she wasn't really able to get out and find the therapist that she needed. So that
Right.
responsibility fell to me. I imagine if there's like an adult child of an aging parent out there who comes across this video, they would be able to reach out with you, and between you and that person, coordinate care for the parent that's at home.
Absolutely. Actually, I'd say maybe 75% of my phone calls are adult daughters. I talk to a lot of adult daughters. So I'm in a similar range. I take care of my parents as well. So
Absolutely. So
yep,
what's
I
going
can
to be the
both
best
ends.
way for them to reach out? And what I'll do is I'll put the contact information in the description below.
Yeah, absolutely. So my phone number is 617-851-5315. So a phone call or a text is always great. And my email, which I can access more easily during the day if I'm treating, is Katie, Katie, at healthyagingpt.com, HealthyAgingpt.com.
That's
And the website
awesome.
got everything on there too, www.healthyagingpt.com.
Perfect. Well, Katie, thank you so much for taking the time to talk to me today.
Sure.
Just hang out there for a minute. Everyone, if you're looking for help in the Massachusetts area, she gave us a list of cities that they take care of, Katie and her team. I'll go ahead and share that below. One last time, Katie, thanks so much.
Thank you for having me and for teaching me everything you know about Medicare. I certainly learned from the source, so it's been really helpful.
Awesome. I'll talk to you soon.
Thanks, Tony.